I just want to borrow 5 minutes of your time, right? Talking a little bit about research in my lab, because we do really cool research upstairs, and it would be good that you know some of these. So this is development of a new dosage form for pediatric use. So it's somewhat related to the lectures I taught. So this is to address an unmet medical need for malaria. As you know, this is the most prevalent parasitic disease in the world. So the most affected population is children less than 5 years old, because there's no pediatric formulation available for them. The example is the mefloquine, which is in the priority drug list in a US BPCA, which stands for Best Pharmaceuticals for Children Act. So there's a huge demand for pediatric formulation, but there's nothing available yet. So in Africa right now, the common practice is that they take adult tablets and the parents just break the tablets into half or even a quarter. So as you can imagine, the dosage adjustment is not going to be very correct. And then they grind that up and add that into food or liquid milk or something. And the drug is very bitter, so a lot of children just spit it out. So it's very difficult to make them adhere to the medication. So that's why the death rates in children is really high. So that's what we are doing upstairs. This is what's sort of an old project in the lab, but right now we are doing similar stuff in the lab or targeting different diseases. So we developed this so-called nanoparticle formulation. So the nanoparticle formulation is composed of lipids. So it's very benign, nothing artificial, just the natural occurring lipids forming this bilayer structure. So this is the bilayer. And we can separate the drug into very tiny particles. And these are tiny particles, each just smaller than 100 nanometers. And they are loaded inside the lipid bilayer structure. So that then this achieves two purposes. The first one is to disperse this insoluble drug into tiny particles, so making it soluble. So making it a liquid formulation for children to swallow. The other advantage is that this bilayer prevents the drug molecules in direct contact with the taste buds to mask the taste. So then we did this test. This is looking at the bitterness of the formulation. And we use E-tongue technology. It's a needle that you stick into the solution of the formulation and then measure the bitterness. So if you see the number going to the right, positive, that means the formulation is very bitter. But if you see negative, that means it's maybe sweet. So we have 10% sucrose, the sugar water, is negative. So we know sugar water is sweet. We have mefloquine suspension. Basically, we follow what is practiced in Africa to compound this. And you see it's very bitter. And we have another control that is infant Tylenol. We introduced this formulation before. It's tolerated by kids. So, but still a little bit bitter with our very sensitive E-tongue. And this is the final one is our formulation, and which is mefloquine liposome. And you see it's just as sugar water. So we can turn very, very bitter drug into sugar water. And so we can also make this as a oral dispersible formulation, because we know that suspension in the liquid form is not going to be stable. Usually we require a refrigerator, right? But in Africa, it's not available all the time. So you would prefer if we can produce a solid formulation and without any preservative. So this is our formulation, and we dried it up. And now we just want to show that it can dissolve in your mouth once it is in contact with water. So in the test tube, we are going to add some water into the vial, and you will see the liquid just, the powder just quickly disappeared and dissolved. And this is under microscope, and you will see very quickly. So adding water now, you see that the powder is gone. Now it's all water. So it has potential to be used as an oral dispersible formulation. Okay, I just want to talk about my research a little bit, just because we love research, and it would be great to have some of you, interested in research and joining us. Right? Thank you.